I'm not able to hear. Is it visible?
No, it's not visible.
It's not visible. It's not visible.
Not visible.
One second. One second. Share the screen. Solution starting. Is it visible now?
Yeah, it's visible now.
Okay.
Yeah.
So, good evening, everyone. So, my topic for today is how to write a high-scoring BMS final year Shalakya Netra paper. So, as per your syllabus, I'm directly starting with the topic because we are running out of time. So, as per the syllabus, everybody know that you are carrying a CBDC syllabus, so which has everything in particular. And according to me, when your syllabus, if we are going through, especially the Netra syllabus, it looks not too vast. It is too sophisticated so that you can learn in terms like you have already attended different PA and different term exam. So according to me, it is actually a sophisticated and like easy paper. So your old batches, like say till 2020 batches, they were having too much complex syllabus that they had to learn all the systems, like even every kathas, like if it is Sandhi Katha, Vatma Katha, all the kathas, they have to learn all together. It is not at all a sophisticated thing that they will not be able to identify which particular question can come for exam. And they will be even worried that what to study, what to study, which can come for 5 mark, which can come for 2 mark, that different way of understanding they have. But in your paper, it is like it is since it is too much sophisticated, so you will be able to identify which is the must know question and which has to be gone for DK and which has to be gone for NK. So it is actually easy for us also to make question paper, and it is actually easy for you also to write the exam. When it comes to our part as a teacher, and you are becoming a doctor. So obviously, for us, it is our duty to make you understand each and every topic in detail. So when you come as a clinician after that, obviously you have to know all the diseases. But when you are here as a final year scholar, it is very good for you that only a few terms or few syllabus point that you have to learn for, especially for 10-mark question and especially for 5-mark question and also for the MCQs. So I'll start the topic today. I have simply made a PPT. I don't think so. From the PPT, you will get too much points. You can hear to my voice. So obviously, you have this learning objectives. So mainly, I'll first discuss about how to write an exam. So you have to understand the exam pattern. You already know your syllabus. You have, I think, 200 pages of syllabus in your hand or the soft copy you will have. So in that, there are different parts they have already mentioned. Where is the must know question? From where it can come? From where the nice to know question can come? From where the decide to know question can come? So you already know the pattern. So first thing, when you have attended your PAs, like your periodic assessment. So if your college has been made in such a question paper that they have taken from the syllabus points, then obviously the pattern of exam by this time you might have understand. So I'm not talking too much about that. And improve the answer writing, time management, and presentation skill. So I will talk more detail about the improvising the answer writing, time management, and presentation skill. So improvise your answer writing in the sense if it is for a 10-mark question. I will first discuss about the 10-mark question, that is the long answers, then the short answers. MCQ, so obviously it can come from any point, any syllabus point. So MCQ, it is upon your luck. And in MCQ, you don't need to worry also much. Why? Because the 20 mark total, there will be 20 mark. So in that 20 mark, and there is no negative. So it is like you will be able to find one or the other question from different parts of the syllabus. So in that, I'm just changing my PPT. I'll show you one thing. So here the first question, that is multiple choice question, that will be number of question will be 20 and mark will be 1 and total marks will be 20. In that the 20 mark, 5% to 5 to 7% of the question will be tough questions. So above average students IQ level based on question. And next 5 to 7% question will be for an average question. So any student of an average IQ can be able to write the next 5 to 7% of question. Then the last one is for a below average student question. It means that anybody can attend this MCQ. Like basically how many Netra Rogas. So the option will be 76, 75, 94 and 93. And if it is particularly asked that if it is from Sushruta, then you have to write the correct choice. It has 76, like that kind of question. So that will be of 5 to 7% of the question. And which dosha is predominant. And which sadhya it is. If it is Kafaja Linkanasha, which sadhya it is. Maybe it can be asadhya. Option might be asadhya, kritra sadhya, or Aushadha Sadhya, at the end Shastra Sadhya. So you have to write the correct option like Shastra Sadhya. So like that kind of question will be for the below average students. So I think that will be, so in such way the 20 mark distribution for the MCQ has been done. So that is the MCQ part. And 5 to 7% which I have told that for the tough questions, it can be like, for an example, where is Amalaki Rasayana Anjana has been mentioned in Vartmagata Roga. This will be a super quality question. It means that it can come for specifically for the one question you have to answer it. Like this specific question choice is that you will get the options like Klinna Vartma, Sikata Vartma, or some other Vatmagata Roga, Utsankini, something like that. The option will be. The correct answer will be the Praklina Vartma or the Klina Vartma. So that Klina Vartma or Praklina Vartma, which comes in Vatmagata Roga, and in Vatmagata Roga, I think second portion. So if you see in my, this one, is it visible for everyone? Is my cursor is visible? Can anybody open your mic and tell me? Because I am not able to visible you people. No?
Yes, ma'am.
Yes, ma'am.
Yes. Okay. So here, if you see the Vatmagata 2, here you will get the MCQ. But when you see the SAQ and LAQ, it comes here no, right? So you will not study in detail for this portion. You will study the MCQ part only. But you will not know that Vatmagata Roga 2 is come mainly SAQ and LAQ is not there. So you will not concentrate this portion much, right? So that is why there is a chance that you can get one MCQ from this paper. So that is a point. So you have to go through all the points which is distributed in your theory paper, because of which like 5 to 7% of the question can come from any of the portion. That is why MCQ, if you see, except eye donation, Baki, whatever the portions which is there, except eye donation, and also one more point here is Panchakarma and Netra Yoga. Apart from this, you can get any point for your MCQ. So MCQ is completely based on your luck and based on how you can do your competitive test. That is mainly the MCQ portion. So I will start from the point. So that is the first point. Like improvising and answer writing is mainly MCQ. In MCQ, this is the way you have to understand. The next one is the LAQ and SAQ. In that, you have to improvise your answer writing, that I will tell in the next slides. And next point is time management. So when you see the time management, this is a very, very important thing. Why? Because your syllabus is very elaborated. See, if you see your syllabus point, See, I've taken a copy of this here. So you can see here that one particular point, I will take it, that elaborate the clinical features and management of doshaja timira. That is a must know question, right? And also here describe in brief drishti vichara as per Shushruta, expound the clinical features of patalakata roga. That is also a must know question. So there is a chance that from these two must know or any of these must know, there is a chance that you can get a question for 10 marks, right? So here, explain the clinical features and treatment of Kacha and Linkanasha. That is also a must-know question. So these three, if I club, then what you can see here is these three can be together for your LAQ. So when a teacher put the question, so it will be like explain in detail about Drishti Vichara along with Patalakata and also the Doshaja Timira. This can be your 10 marks question along with Linkanasha. So you have to this you have to write in an elaborative way because it is an LAQ. Understand? So this is how. But how much time you will have because it's a this much big question. So we will not have much time for writing the answer. So what you have to do? You have to manage your time very properly. So how to manage this time? So I have made a approximation that I hope everybody will have the cool off time. So 10 minutes you will have to read the question paper and plan your time accordingly. So for that you are getting the reading cool off time. And any question if you are not able to write properly, so what you have to do? The behind page in your answer booklet, there will be a page which you can use for your rough work. There you have to memorize it and write at that time, that particular time. Start writing. Okay. Start writing which question you are not able to reproduce at particular time. So you can make a point if the question comes for uh, myopia. If the question is of myopia, so please write myopia. What and all points you are remembering. Okay, the concave spherical lens will be giving that. So that point you are memorizing. Okay, got it. And in OPD, how many patients you are seeing myopia and what and all type of myopia you are seeing, simple myopia, pathological myopia, whatever the idea is coming, please scribble it in the paper where it is used for the rough purpose. So that 10 minutes has to be used for reading only and for time management. So next one is 10 minutes only for an MCQ. The 20 questions of MCQ you have to write in 10 minutes. Try to complete it within 10 minutes, which you don't know. No, keep that marked for the last moment to write. Okay. So within 10 minutes, you try to complete that 20 MCQ. And you can take 20 minutes for each long answer questions. 20 minutes only, not more than that. If it is nearly 18 to 20 minutes or 17 to 20 minutes, it will be very clear. Like you will get the complete time for the short answers also. You can complete the entire paper. I've seen my students, they will try to write all the question. But what happens is after writing the short answers, because they will be knowing too much about the short answers. So what happens at the end, they will not get time for the long answer questions. So it will be difficult for them to complete the long answer question. So what some teachers for the answer checking, whenever whoever goes for the answer checking, there is a problem that they can see the pages also. If it is written only one page front and one page back, seeing that paper, what they'll think, they don't know much. So that's why they jumped into the another question. So there is a thinking, there is a chance that the teachers also can think in such a way. So it is always better try to complete the long answer questions and short answer question in the stipulated time along with covering the pages also. So okay. So if your handwriting is very good and you have all markings like diagrams and all you've completely marked and all the answers you have attended, like at least you have filled 2 to 3 pages, obviously you're going to score good. Okay, so this is how you have to manage your time. Then know the question paper. So first you have to read the paper carefully that you should not get any, you should not find any question which is misleading you. You should not find. If you have a correct question which you are not at all able to understand, try reading it 2 to 3 times. Then also, if you're not understanding, you're finding any question which is mistaken, like it is completely mistake, you are which is not at all relevant to the subject, then you can ask the whatever whoever might be the might be in hall any whoever might be the teachers present in your hall, you can ask them. Other than that, you don't need to, you have to read the paper carefully, and you have to try to attempt all questions. Attend with the question number. What I mean here, attend with the question number, is that some people, what they'll do is they will not write the question paper. They'll start directly from the answer. So what happened? In Rajiv Gandhi University and all, you will see the teachers, how will they correct the paper? They will be seeing the screen. It will technically too much updated. So they will see the screen and they'll be correcting the paper. So if they don't find the answer number there, then what happened? Obviously, they'll just skip the answer. They'll skip the answer and you will not get the mark for that. So better always write the question number there. That I mean is the answer number. Always you have to write. Then whatever the question is, if the question is describe Puyalasa in detail, or define Puyalasa and write the etiological factor and management in detail. If that is the question, you write Puyalasa or dacryocystitis in the heading. And after that, you start writing the detail. So question number and the question. What is the question? In that main point that you have to write in the question paper in the front. Then only you start writing about it. Otherwise, teachers also will get confused which question she has attended. That you should not repeat. And in MCQ, one point I have to tell is your answer is 1. And maybe the option correct might be B option. But you are getting confused, or maybe by mistake, you are writing option B, but the answer which was there for the A option, if you're writing that, you will not get mark. You will lose the mark. Like for an example, if there is one question, a same example I'm taking. If Linganasha, Kafaja Linganasha is which Sadhya Vyadhi, according to as per Sushruta. So option A is Shastra Sadhya and option B is Sukha Sadhya. If this is the case, then answer is actually option A, Shastra Sadhya. But what some people write is option B they will write. Option B they will write, and they will write it as Shastra Sadhya. So it means you are going to confuse the examiner, right? So at that time, you will not get the marks for A also, B also. The answer will go wrong. So don't do such things, because that time maybe your intention might not be bad, that it was by mistakenly you might have given this, but at point what happened, there is a high chance that the examiner, what they will think, that you are trying to fool the examiner, so you will not get the mark, and that impact will be there for your full paper. Okay, so better not to attempt such mistake in your exam, and follow the mark distribution that I have already told. Time management I have already told. And structure of the long answer. If it is a long answer question, so for an example, if your question, which I have already told, if it is the question is regarding Timira, then you have to mainly write the definition, then classification, and if any nidhana which is particularly impacting Timira. So our nidhana, like Ushnabhitaptasya Jala Pravesha, when we go for that, the Timira mainly, Sukshma Nirikshana, Ratri Jagarana, these all are symptoms that mainly pertaining for Timira. So you can write like nidhana, Sukshma Nirikshana and Ratri Jagarana, these all can nidhana, these 2 points you can write it as nidhana. Don't write the complete shloka for one only that peculiar disease. What happened is again what the examiner think, this guy or this person might not be knowing the nidhana properly. That's why they only know the one shloka of Netra Roga Nidhana. That's why they have copied this. So that is the impact you are going to give the examiner. So better, whatever the Nidhana, out of the complete Nidhana, whichever Nidhana you know, basically that you have to write. And Samprapti you can write. Obviously, you will be knowing by now. You might have written 30 plus, maybe 20 plus journal, means your case reports. So obviously you will be knowing how to create a Samprapti. So based on that, you can create a Samprapti. And Lakshanas, if it is Doshaja Timira, Vataja, Pittaja, Kafaja, whatever, so and so, whatever the Lakshana you know, write it. If shlokas you are knowing, please write all the shlokas, because shloka carries, they will teach. And it will, obviously in the examiner's eye, it will be giving a good impact about your paper, that they will be thinking that you have studied good. So if it is a LAQ question, out of 10, you can score maximum 8.5 mark if you write all the shlokas. And diagnosis, you don't need to mind this, and you can directly go to the Chikitsa. And since it is a long answer question, you have to write about the modern correlation and also the conclusion. So conclusion in the sense, you don't need to write it as conclusion. You can just skip, like after modern correlation, what is the modern treatment, you can just write and you can skip it. If it is Timira, if it is coming, and if it is particularly some Patalakata Timira or Dosha Timira, if they have asked, then obviously you don't need to write about the modern correlation because that will go vast. Okay. Everybody is following. Any doubts till now? Is everybody following? Okay. So the next point is diagram. So you have to label the diagram. Since it is an eye portion, so for an example, if any question which is related to the cornea or the eyelid or the lacrimal apparatus or the fundus, if anything related to this, for an example, the question comes from the diabetic retinopathy. If it has come for SAQ or LAQ, anything, and not LAQ, most probably SAQ. If it is coming for diabetic retinopathy, for the 5-mark question, if you draw a picture and if you mark all the signs which you see in the fundus, so that will carry an extra weightage for your paper. And lacrimal apparatus, if lacrimal apparatus is there, for an example, if Puyalasa has been asked, you might have learned everything in your eye examination, in your practical classes. So you already know the lacrimal apparatus. There will be a test which is called as raw plus test or regurgitation on pus discharge of lacrimal apparatus. If you know that test, you can mention about raw plus test. And if you know about the lacrimal syringing, so mention about lacrimal syringing, how to perform that. If it is a 10-mark question, if it is just 5-mark question, no need to waste your time for it completely. You can just write about the dacryocystitis and Puyalasa. But if it is a 10-mark question, so completely concentrate on the diagrams as well, and also write the examination which you have learned in the practical class. So raw plus is one and lacrimal syringing, and after that you can even write about the dye tests, John's dye test 1 and John's dye test 2. This you can write, and also draw the nice picture of a lacrimal apparatus starting from the lacrimal glands ending in the nasolacrimal duct. So such a good picture you can draw. So again, for the drawings itself, 2 marks you will be getting. So better write in such a way that the examiner should get impressed by your paper. Presentation tips, which I have already told about using heading, bullets or numbers you can write, and underline and margins should follow, and better use a blue ink and with a neat handwriting. Obviously, first few pages your handwriting will be good, and later when you go, your handwriting can get a little back off. But still, it's fine. It's not a bad thing, but everybody will understand. If your handwriting goes too much cursive and all, nobody is going to mind. But try to be concentrate with your handwriting as well. I think this you might be knowing because since you are in final year, this and all you will be knowing. So try to use the Ayurvedic terminology. See, you will not be knowing shloka. So what you do, you will write all the symptoms like slimy discharge, watering from eye, pain in the eye. This and all you will write. So apart from that, you can write Sasamramba or Raga, Shofa, or these are terminologies you can use. So for if you use the terminology like Ayurvedic terminology, what happens is, again, people will think that at least you have read something from the textbook or the classical textbook. And one more point which I have to tell is that if it is Vataja symptom, everybody will write Tatra Ruksha Lagu Shithakara Sukshma Shalonilaha. Taking from that shloka, and everybody will write each and every symptoms of Vata. But better not to try that here. Why? Because in Netra Roga, everywhere you will not find the same symptoms of Vata over here. For an example, if you take Vata Adhimanda, you will not find these all symptoms over here. It is entirely different from what you have studied from this, all the like Tatra Duksha Lagushida. That sloka is completely different over here. That is only talking about something which is pertaining only for the eye. So that is a complete mistake you are going to make. So if it is Pitta, everywhere you will write Raga, increased burning sensation, this all you will write. But sometimes, if you don't know anything about the answer, nothing about the answer, so you want to write, okay, fine. So try to attempt such question at the end time. Luckily, if your paper in the examiner's hand, if it is the last paper, obviously you will get mark over there. But if you know the answer, half, just to feel that you're adding extra points, better not to write such things in your answer sheets. Okay? and try to do some clinical questions, clinically related answers you can write in your papers. Um, so common mistakes are poor handwriting, no diagrams, incomplete answer, and avoid missing the samrati. These all are the common mistakes people make. But if you time permits, try to add these all points in your paper. Then next one is, here the golden rule is that use Samhita references, flow charts, diagrams, and revise. So here, what I mean is that use Samhita reference in the sense, try to quote a shloka, or not, you can at least mention the reference according to Ashtangridaya Uttara or according to Shushruta Uttara Tantra. This reference you can quote while writing. Okay. And while writing everything, point it out like a bulletin, like you can put it like an arrow or like what to say, hash, as a some like this, something you can put. And after that, you start writing. So what happens is that people will think, or the examiner will think, okay, she has read something or he has read something, so she's writing in this way. So that is why Samhita reference and also bulletins are very important, and flow charts. What people mainly does is that they will be writing the complete answer in a paragraphs. So too much paragraphs also, what happen? People will not be able to understand it, right? People will not be able to, the examiner will be having too much difficulty while seeing your paper. Already so many paper one examiner has to see. And upon that, if you're writing paragraph, what examiner will think? Okay, this is making me too much tired, so I will not read this. So maybe whatever he's seeing, he or she is seeing superficially, based on that, you will get the mark. So better put it in a flow chart so that your answer is again bit sophisticated. So we will be able to read it properly. So better try to make it flowcharts. And as I already told, diagrams are will always carry weightage in your paper. So try to put diagrams. Since it is an I portion, so you will have to put one or the other diagrams related to I in every answer. So if you put 3 or 4 I diagrams also related to the specific question, so obviously you will carry the mark for that. Maybe 1 or 1.5 or 2 marks only for that. So you have to concentrate. Obviously, you have to read about netra, eye anatomy. Then that first portion, that Sharira, netra Sharira Rachana. And after that, the anatomic portion you have to learn. Kriya Kalpa, any portion can come for must know, and as well as Soda SAQ. And Abhishyanta and Adhimanda along with glaucoma. So glaucoma is a special entity. So obviously there is a high chance this question can come for LAQ or SAQ, specifically glaucoma. Timira, I've already told. Cataract you have to read. Why? Because cataract first portion is in must know portion. So cataract can come for 5 marks. Uveitis and diabetic retinopathy, again, this also can come for SAQ. So next I will discuss about this. What I told here is, so this is the technique of a theory exam, a theory question paper setting faculty has to think about. So you might have seen here, see, particularly till here, that is till Santikata Roga third. So obviously you will be knowing what and all are the contents in this. So here in Santikata Roga 3, third, till here only 30 mark question an examiner can put, a question paper faculty can keep only 30 mark question. In that 30 marks, some or the permutation and combination the examiner has to do to fulfill this. Right. So we will go for the LAQ first here. So Samanya Chikilsa and Kriyakalpa. This is one portion for LAQ. First this one, and second one is Santikata Roga 1. Santikata Roga 1, in that main point is Puyalasa and Upanaha, as I remember. Puyalasa, Upanaha and the Srava, as I remember so. So obviously, only out of these 2 points, one has to come for your 30 marks, right? So from here, one question, either it will be from the Puyalasa Upanaha Srava, or it can be from this Kriya Kalpa. So you can imagine what and all question can come for the LAQ. Why? Because it's Kriya Kalpa. First question will be enumerate Kriya Kalpa according to Shushrutaracharya or not Sarantaparacharya. That will be there definitely. And after that, since it is a 10 mark question, I don't think so everybody will think to put Seka, Pindi, Vidalaka, and Ashtodhana. Why? Because LAQ means you have to write a lot in the answer. So most probably Tarpana and Anjana will be the thought of thinking. It doesn't mean that another will not come. There is a chance that can also come, but most probably it will come as Tarpana, Pudabhaga, and Anjana. That will be most wastage carrying here from the Kriya Kalpa. And the same way, if it is Santikata Roga 1, if you see your previous paper, like this kind of thing, I have not put from Santikata Roga 1 here. So if you see your syllabus point, only Puyalasa comes in your must know paper. Rest all will be going for your DK. So if that is the case, then Puyalasa or Shrava. Shrava is also coming over here. So if that is the case, then from this, either Shrava or Puyalasa can come for your LAQ question. So here LAQ will be either from this or from this. Okay. So anyone among this only can come for LAQ. And when you see SAQ, so this has to, you have to think about this also because it is carrying 30 mark and 1, 2, 3, 4, 5, 6, 6 question from MCQ we put also. Then whatever the rest comes from, you have to complete from LAQ and SAQ. So you can think maybe 2 LAQ and 1 LAQ and 2 SAQ from this, and maybe 5 questions from the MCQ. Most probably that is the chance of getting 30 mark. So SAQ can be from any of this. So that also you have to see. Sanya Harana will not come for SAQ. So there is a chance that it can come only for MCQ. There is no LAQ as well. So in the same way, if it is somewhat from this, there is a chance that Netra Roga, if it is come, there is a chance that it can come from here because this is not there in your LAQ. And in this point only, there is coming your Netra Rachana Sharira and eye anatomy. So there is a chance that it can come for your SAQ. SAQ, this can come. Okay. So, and if already LAQ come for from the Kriya Kalpa, if it has come 10 mark, then there is no chance that it can come for SAQ. And again in Panchakarma in Netra Roga, SAQ, but that also very less chance. But if it is coming only, it can come for only 5 mark. If Panchakarma and Netra Roga, if it comes, then it is very easy for you people. Why? Because Panchakarma, whatever you are seeing the procedure, whatever Netra Roga you know, you can club everything and you can write it off. Okay. Then Santika Roga, which I have already discussed. Then this is how the paper goes. So I'm only explaining about this. The same way, if you go through this, I'll talk about this too. Here, your LAQ can come from only Shuklakata Roga. And in second, this one, the Vartmakata Roga, there is no LAQ at all. If you see the Vartmakata Roga 2, all together Vartmakata Roga, if you see, there is no LAQ at all. So you don't need to study Vartmakata Roga 1, 2, 3, 4. The complete LAQ. So you have to prepare only for SAQ. So if it is SAQ also, it should be must know or DK. Then only you can get it for 5 marks. So if you see the Vartmakata Roga, mainly Utsankini can come and Pakshma Kopa can come, Ectropion, Entropion can come. So these are the main area of concentration for SAQ. And so that is how it is. And Krishna Kata Roga, if you see, it will be like LAQ for Krishna Roga 1 and Krishna Kata Roga 2. Both can come for LAQ. That is even Sabrana, Abrana, Achaka, Jada, Akshipakatyaya, everything which comes for S for LAQ. So there is a chance that Krishna Kata Roga, you have to concentrate very much because why? Because it is having MCQ, SAQ, and LAQ. So please read thoroughly for Krishna Kata Roga. The next one, glaucoma is a specific entity. So there is a chance, again, this is also MCQS, LAQS, SAQS. Glaucoma also is a must study topic because there is a high chance that it can come from this. And Sarvakata Roga 1, again, SSS means Abhishanda and Adhimanda, you have to study thoroughly because there is a high chance it can come. So for an example, if your question is Abhishanda, and last point I will tell, even Drishtikata Roga 1, that is your refractive errors and Timira Kachalingdanasha, that point also you have to study thoroughly because that is also SAQ and LIQ point of question. Nayana Abhikata is only 5 mark question. So just read for only 5 mark. This is how the mark distribution or the exam committee will make question accordingly. If the exam question paper committee is following your syllabus properly, then obviously this will be the pattern of your question. Okay, so I will explain how you, if for an example, if your question is Abhishanda to explain, and your question paper will be very specific for the question, like describe Abhishanda or enumerate Sarvagata Roga and explain in detail about the etiology, clinical features, and management of Abhishanda. This will be your question paper. So what you have to write? Enumerate Sarvagata Roga. So you have to write enumeration. So you have to write all the Sarvagata Roga's name. Abhishanda, Adhimanda, Hatadimanda. So all together you have to put up together. That will be your enumeration. After that, what? Describe about Abhishanda. So you have to write a line, or you have to write about the definition of Abhishanda in one or two lines. Then after that, what you have to write? You have to describe Vataja Abhishanda, Pittaja Abhishanda. That will be the thing which is expected from you. What are the different types of Abhishanda? So types you have to specify. And if you know the sloka, write everything in detail. If you don't know the sloka, at least try to write the Sanskrit terminology for the sloka and for the answer. Then after that, after writing the types, uh, you have to mention about the management. After, if you know the sloka again, you can write. If you don't know the sloka, at least mention what treatment can be given. And practically what you give in the OPD, in your OPD, what your teachers are giving, that same treatment also you can write. If you don't remember the shloka properly, or if you know how to write the treatment, if you have already studied from the theoretical part, please write the shloka which you have already known. Okay. Then after that, try to write about conjunctivitis in a small, very small, 2 to 3 or 4 or 5 lines, max to max 5 lines. Only that much, because you will lose all your time in writing about Abhishanda in detail. If it is a SAQ question, just mention about this 5 Abhishanda. Then no need to mention about conjunctivitis. Just write correlation as conjunctivitis. That itself will be sufficient for 5 marks. But if it is for an LIQ question, so you have to write in detail about Vadaja, Pittaja, Kaphaja, Raktaja, Abhishanda altogether. Then after that, you have to write the treatment aspect, and also you have to write in detail about the conjunctivitis. Okay. So that is how you have to write. And what diagram you will draw that, if it is possible, just draw a picture of eye and just mark the ciliary congestion or the conjunctival congestion, what you will see. And if it is a kind of allergic conjunctivitis, you can draw little, you can draw little discharge, mild secretion. That just draw and just mark there will be a discharge. So what the examiner will think, okay, she or he has know the features, they have seen the cases. Okay, so that is how you have to present your answers. Okay, so this what I've already told. You have to see here whether it is a must know question or designed to know question, and see through this. There is a chance that from where it can come, whether it can come through that or not. Basically, it's a very easy syllabus. So if you know, if you have idea of this, no, distribution of theory mark, and if you know whether it is must know or DK, so obviously 5 DK means obviously it can come for 5 mark. If it is MK, there is a chance that it can come for 5 or 10 marks. So basically, in this way, you have to learn. Okay. Then the same thing which I've already told. Here you can see the Sarvagata Roga. So the question will be the same thing. So whatever is represented here, the same thing can come for your question. Like enumerate Sarvagata Roga, describe Lakshana, Chikitsa, and complication of different types of Abhishanda. This can be the question. Or it can be like clubbed together. This enumerate Sarvagata Roga, explain about Abhishanda, and write in detail about the conjunctivitis. This can be the question. Okay, so since it is a must-know question and your Sarvakata stands for the first one, like that is for all the parties S. So this question can come for sure. Because why? Because this is only 18 marks from only this much portion. So either this Abhishanda will come for 10 marks, Abhishanda or Adhimanda portion can come for 10 marks, or glaucoma portion can come for 10 marks. This is how the distribution has been given. So this is from my part. So thank you so much for attending the class. Thanks for trusting me, and thank you, Krishna Anna, for calling me for this class, and best wishes for everybody for writing the university examination. So, yeah, this is from my part.
Thank you, Dr. Jasna. You have students, if you have any questions, please ask. It's your time to ask questions, and please clear your doubts before going to the.
Hello, ma'am. Good evening.
Good evening.
Ma'am, will be questions asked from the NLHT MK topics in the question paper for like in theory questions?
Um, Actually, the theory question paper distribution most probably from the part where the lecture theory ever. So most probably you will not have you find any topic which is must know or designed to know, like which I have shown till that. No, in that any non-lecture theory ever is coming in the MK and DK. Have you find anything like that?
Not now, but we have found some like some of the topics which were
Can
not
you
taught
can you
in the
give me an
practice.
example? Can you give me some example which you have got the question so I can tell about
Like
it?
the
Syllabus.
surgeries or the
Which one?
procedure,
Which? See,
dacrocystitis procedures as a
yes,
whole.
dacryocystitis. Yes, obviously. Why? Because dacryocystitis is a portion where what happens is if you see dacryocystitis definition and also the portion of the first portion. One second, I'll open the syllabus.
Okay, ma'am.
See, if you open your syllabus in that Santikata Roga 1, it is NLHT comes as 0 there and NLHP comes 2 there. Have you seen your syllabus?
Yes, ma'am.
So you can open your syllabus. So in that, what happens is you will get a answer, question for in that must know is only describe the clinical features and management of Puyalasa and define and describe the types of dacryocystitis. That is the
Yes, ma'am.
only portion which is 4 year must know.
Oh,
Okay,
yes, ma'am.
and there is no NLHT. Actually speaking, there is no NLHT. So the question can come from only that portion. Since if you have got
Okay,
that
ma'am.
the question, then obviously they wouldn't have checked in this detail. They might have thought the dacryocystitis, which is already there in must know, so the treatment you should know. Based on that, you might have got the question.
Okay. And also, ma'am, in they have given the karmas, Bhedana karma, Lekana karma. They have only
Vedana
given
karma,
for
lekana can karma
NLHT.
can for 5 marks. Ha,
They
Vedana
have
karma and
given that
lekana
only for
karma,
NLHT.
NLHT.
Yes, they are MK, but they have
Ha,
given under NLHT topics. So those are like direct questions.
um,
So can they come?
that can come for 5 marks because we have done in our lecture hour only. So that can
Okay,
come
ma'am.
for 5 marks because the question, as per the question distribution, there is a chance that it can come for your SEQ.
Okay, ma'am. Thank you.
Yes.
Another question is there.
Okay.
Should we by heart Chikitsa slokas?
Which one? I cannot
Chikitsa
hear.
slokas. Chikitsa.
Chikitsa sloka by heart. No need to by heart the Chikitsa slokas. Only if you know the Lakshana, that is more than enough. No need to by heart the Chikitsa sloka. If you know the Chikitsa, as per the classic, like for an example, if it is, for an example, I'm saying this, Shushkakshipaka. If you know about Shushkakshipaka. So what you have to write is, according to Acharya has told that Abhisha, Panam, then Anutaila Nasya, then after that Jivaniya Gatatarpanam, then after that Koshna Bhaya Saintava Sega. This is the Acharya has told in sloka, like complete sloka form. But if you know like how I presented now, like it is only this much, like Gritapana. First you have to give the Vireshana. And one more point what you have to add is that when you learn the shloka for the Chikilsa, better only go for choosing the Ama and Nirama Netra Lakshana. Based on the, you might have already known the Ama Nirama Lakshana because it is already there in your syllabus. So if you know that, what you have to do is, based on that, you can write all the answers, all the chikilsas. No need to write all the what chikilsa shlokas, which is specifically for that particular disease. Better go for the Sama Nirama Lakshana chikilsa. So write that chikilsa, and after that, if you feel something about the OPD treatment, if you write that, then you will get the mark. No need to by heart any shlokas. Am I clear?
Another question is there. Any questions on instruments? Did you get any
Instrument
questions?
question basically, no. Actually, tonometry is the only portion, as I feel, it is there in your NLHP. So most probably not a chance of question. See, I am saying basically the chance of question. Whatever the other thing, based on your university, there is a chance. Because now here I have so many Rajiv Gandhi University students, so many Kerala University students, or so many Parul University students, or in Gujarat somewhere the students I can see here. So it completely depends on your question paper setting committee, how they make the question. If they are completely following the syllabus, then there is a chance that you will not get. But if they are not following completely into it, because it is a university decision. So if they are not completely following it, then obviously whatever you have learned, so anything can come from SAQ or LAQ. So usually tonometry is the chance, but obviously when we go for the theory examination set, most probably it will not come. Any other question?
Any other question? You can unmute yourself and ask, no problem. Do you have any other questions?
You can put it
There
in
is
the chat if any questions.
If you don't have any question, we can end the meeting.
Yes.
Any questions?
Ma'am, will be there any question building a case? No. Will there be a question on building a case? Is that you mean? So if that is the question, then that question probably won't be there. Okay. So that question probably won't be there. But there is a chance that you get a question like already built case. Like a patient came to OPD complaining of a swelling in the upper eyelid since 2 to 3 days, and which is worsening since 2 to 3 days and associated with redness, watering. This and like already built up case, and diagnose this case, and correlate it with Ayurvedic portion and what are the clinical features. So, like this question, the already build up question can be get. Like there is no chance that you will get a question to build up the case. So you will not get time also for that. So I don't think so. The question paper building setting up people will be that cruel to ask you to build a case. So that will not be there. One more question I've seen popped up, but I'm not able to see it.
What about Vartamagata Rogas? Total 21 rogas to be read, or only 11 mentioned in syllabus?
11 mentioned in syllabus, right? Only 11 has mentioned in your syllabus. So obviously from that only you will get the question. That is the justice towards your syllabus. That is the thing which a question paper setup team has to be done, showing justice towards your syllabus. Only from the syllabus which you have done. Only they can ask like enumerate 21 Vartmagata Rogas. So if they ask for the enumerate 21 Vartmagata Roga, obviously you have to write all the name. Not that you don't need to write, study in detail about all the Arbuda, Arshas and all. No need to study. But whatever they have told in Vartmagata 1, 2, 3, based on that you can write. Only that much you have to study. And that also which I have told already. that there is very least chance it will not come for maximum LAQs. It will come maximum for SAQs. Yes. How to score maximum 10 mark. One question has popped up. How to write maximum
10 mark
10 mark
questions.
question.
What points we don't miss to score max? What
You
points
should
we
not.
don't?
Yeah. So in LAQ question, basically the question, if it is modern, there is a least chance that only one modern point can ask for 10 marks. So there is always high chance that it will be clubbed with an Ayurvedic portion. Why? Because if it is not clubbed, then you will not be able to write that much portion in a LAQ question. So usually it will be like a clubbed question with your Ayurvedic portion. So what happens is, for an example, if the question is about glaucoma, yeah, glaucoma is the portion where you can get the question for 10 marks. Only glaucoma. Why? Because the content is too much. Like you have to describe about primary open angle glaucoma, and also you have to explain about ankle closure glaucoma in detail. So for an example, if it is the question about glaucoma, what you have to write is about first the definition of the glaucoma. So don't write that glaucoma is increased IOP. That is not the definition of the glaucoma. So you have to write about it is a progressive vision loss which is affecting the nerve layer, which is affecting the optic nerve, and later it is causing the effect on the retina. That definition, progressive retinopathy, that 3 or 4 points are there. That definition you have to by heart and write it for the definition. Glaucoma, obviously you have to study because that can come for, I've shown you that it is S. So the definition itself is very compulsory. If it is short answer question also, LAQ also, you have to write that. Okay. So it's a very important point to be written, study, that is glaucoma. So you have to write the definition of it. After that, the classification or the types of it. That is again POAG and PSEG. That you have to define, write it. And after that, what you have to write? You have to write about the passage of aqueous outflow. So there you have to mention about the uveoscleral outflow and trabecular outflow. That you have to write in detail. There you can draw a picture of it. Then you can draw the picture of the ankle of it. You can draw the picture of the ankle of the cornea and the iris, and how this pumping mechanism, how the aqueous humor is passing through this. That picture you can draw. After that, you can write about the clinical signs and symptoms of POEG, then PSEG. Whatever you are seeing in OPD, gonioscopy, if you know how to do the gonioscopy, write about it. If you know the slit lamp examination, write about it. Then after that, you have to write about the treatment. If you know the procedure of iridotomy, mention about iridotomy. And if you know about the medicines like pilocarpine. So it has to show like you have completed the paper with a diagram, with the flow chart. That is how you will get the mark. Understood? I hope the 10 mark question, which I've taken the example, would be helpful. Any other question?
Good
Okay.
evening, ma'am.
Okay, Veda. Yeah.
Ma'am, in case if you miss to draw the diagram like in a 10 mark question, then how much marks like it would be deducted, or if it's not been mentioned in the question that we have to draw the diagram, and if we are not drawing, so like there's a need to draw the diagram compulsory?
No, Kritika, it's not like that. It is not mentioned, or it is obviously in question. They will not ask about you to write the complete diagram. They will not ask. It is from your side that you are to increase the weightage of your paper. You are just drawing it. If you don't write also only max to max, you will lose 1.5 mark. Maybe you will not lose also, but you look your paper attractive. See, if you want to score 10 out of 10. If you draw the picture, obviously you will get 10 out of 10. Maximum 9.5 also you can get. If you don't draw the picture, maybe you will get 8 or 7.5. There is a chance. And if you don't write about aqueous outflow in detail, for the example which I have told recently, if you don't write the aqueous outflow flow chart in detail, but you are drawing the picture, obviously you will get extra 2 marks, right? So in this way, it will not mention about the describe or draw the diagram. Nobody will tell that. It is your thing that you are drawing the picture for giving more weightage for the paper.
Okay, ma'am. Thank you.
Another question is there. It's
Okay.
enough to mention the type of chikitsa like Anjana, or we should write ingredients also.
That is actually depend on the question. So if you are writing Anjana as a Kriya Kalpa, then obviously you have to mention about the ingredients. If you are not mentioning, if you are just simply writing Mahanila Gudikanchana for Avrana Shukla, if you are writing Mahanila Gudikanchana, obviously the paper, those who are seeing the paper, obviously they will think, this girl or boy has studied the classics. So no need to mention about it. It depends completely on the question.
Okay. Any questions, or shall we conclude the class? Okay. Thank you.
Thank you so much.
Thank you.
And I think my
Krishna,
students
Chandran.
are only more here. I can see so many of my students here.
They are very studious, I think so. Even after class also, they say they are sitting in your class.
Okay.
And thanking
So
Krishna,
thank you
Chandran.
so much. Thank you so much for this opportunity. And basically, Krishna is my senior, and so many classes is going to happen in future also through the Google Meet. So I'm so thankful to you for welcoming me and giving me an opportunity to take this class. Thank you so much, Anand.
One question is there. Shall we follow according to
Okay.
Shushuta or Bhatta?
It depends on the university. See, basically here it is like completely Shushruta following people. But if you're writing exam in Kerala, then obviously you have to follow the complete Ashtanga. If it is in Rajiv Gandhi University or Padul University, obviously you have to follow Shushruta. But you have to know about Ashtanga if there is an extra thing which is told. Like if any extra mentioning which is told, like the Chikitsa of Pakshma Kopa. If it is extra mentioning from Ashtanga, you have to follow that. That's it. If any other university students are here, please tell me. So if it is completely from Karnataka to here, I have seen that mostly people are following Sushruta Samhita. On Kerala, people will follow mostly Ashtanga.
Yeah, second paper is there. We will notice it. Don't worry.
Second paper, ENT paper, that you will get another class.
Yeah, another class is there. Don't worry, we will notice in the group. And thank you, Jasna Chandran, behalf of
Thank you so much.
Ayurreshmi and the participants. Behalf of busy schedule, you have given class for us. Thank you so much.
Yes.
Thank you.
Thank you. Thank you. Thank you.
Thank you, all participants. Good night. Have a nice day.